Right now, while you're watching this, someone's brain is shutting down, not tomorrow, not someday, right now. In this exact minute, someone just lost the ability to recognize their own child's face, and they're never getting it back. In the next 40 seconds, someone in the United States will have a stroke. You might be thinking, okay, but that's not me. Maybe you're right. But here's the part most people don't realize. The people it does happen to, almost all of them thought the exact same thing. Hi, I'm Dr. Michael Kent, and in the next few minutes, I want to give you something very few people actually have. Not a pill, not a device, not something expensive, just 4 letters, and information that research shows most Americans still don't know. Information that, if you had needed it yesterday, could have meant the difference between walking out of a hospital or being carried out. So stay with me, because what you're about to learn might be the most important thing you see all year. And I don't say that lightly. Let me give you a number first. Every 40 seconds, someone in the United States has a stroke, and that's not a made-up stat. That comes straight from the Centers for Disease Control and Prevention. Every 40 seconds. More than 795,000 people every single year just in this country. And worldwide, according to the World Stroke Organization's 2024 fact sheet, there are over 10 million new strokes every year. But here's the part most people haven't heard. Researchers with the American Stroke Association published updated guidelines in late 2024, and they made something very clear. Up to 80% of those strokes may have been preventable. Not 10%, not 30%, 8 out of every 10. So you're probably sitting there thinking, why didn't my doctor tell me this? And honestly, that's a fair question. Doctors are busy, appointments are short, and prevention, it gets talked about a lot less than treatment. That's exactly why you and I are having this conversation right now. But here's what really keeps me up at night. It's not just prevention, it's what happens in the first few minutes when a stroke actually begins. Because here's the truth, most people who've witnessed a stroke didn't realize that's what they were seeing. They thought the person was just dizzy or tired, or maybe had too much to drink at dinner, or was just acting a little strange. And that pause, that hesitation, that's what cost everything. So today, we're going to focus on 2 things. First, how to recognize a stroke happening right in front of you in about 10 seconds. And second, what you can start doing this week to lower your chances of ever being in that situation. Nothing complicated, nothing extreme, just clear signs to look for and practical steps you can actually take, because both matter and both are absolutely doable. Let me explain what's actually happening inside the brain during a stroke. Once you understand this, everything else we talk about will make a lot more sense. Think of your brain like the most important building in your city. It runs everything: your legs, your speech, your memory, your ability to hold your grandchild's hand and actually know who they are. And just like any building, it needs constant power. For your brain, that power is blood. Every second, every single day, blood carries oxygen and fuel through tiny vessels deep inside your skull, keeping everything running smoothly. Now imagine one of those tiny vessels gets blocked, like a pipe clogged with buildup, or it suddenly bursts. Everything downstream from that blockage goes dark. The lights go out in those rooms, and those rooms control something. Maybe it's your right hand, maybe your ability to speak, maybe your balance. Here's the truly frightening part. Every single minute that blood supply is cut off, roughly 1.9 million brain cells die. That number comes from research published in Stroke, the Journal of the American Heart Association. 1.9 million cells per minute, and unlike skin cells or liver cells, brain cells do not grow back. When they're gone, they're gone. That's why in the medical world, we say, time is brain, not time is money, time is brain. Because every minute you wait, you're literally losing your brain, cell by cell. This is also why one particular treatment is so critical. A clot-dissolving medication called TPA, tissue plasminogen activator. It can physically dissolve the blockage and restore blood flow, but it only works within a very specific window. We'll talk more about that in a moment. First, though, you need to know how to spot a stroke as it's happening. All right, 4 letters, 10 seconds. This is what neurologists created after watching thousands of patients arrive too late. They asked themselves, how do we make this so simple that anyone, any age, any background can do it? And this is what they came up with, FAST. Let's go through each letter slowly because you want this to stick. F is for face. Look at the person's face. Ask them to smile. That's it. Just say, hey, can you smile for me? Now watch carefully. Does one side of their face droop? Does it look like half the smile didn't get the memo? That's not tiredness. That's not a weird mood. That's a warning sign. The stroke is blocking the nerves that control that side of the face. Now here's something people often miss. You might notice it even when the person is just sitting still. One corner of their mouth might sit lower than the other, or their eye on one side might not close all the way. Don't brush that off. A is for arms. Ask them to raise both arms straight out in front of them like they're holding a tray, flat. Tell them to hold it there and close their eyes. Now watch carefully. Does one arm drift downward, or can they not even lift one arm at all? That's the stroke cutting off communication between the brain and that arm. The arm is still there. It's just not receiving the signal anymore. S is for speech. This one's simple. Ask them to say a short sentence. Something like, the sky is blue, or today is a good day. Now, listen carefully. Does it sound slurred, like they've had a few drinks? Are they mixing up words or saying things that don't make sense? Do they start the sentence and then stop, like the words just won't come out? That's the stroke affecting the language center of the brain. They may know exactly what they want to say, but their mouth simply won't cooperate, and that is terrifying to witness. So stay calm, be kind, act fast. T is for time. If you see even one of those 3 things, 1, you call 911, not in 5 minutes, not after checking a few things, right now. Don't give them water, don't give them aspirin, don't put them in your car and drive. You call 911 and say, I believe someone is having a stroke. Symptoms started approximately this many minutes ago. We are at, give the address. Why does that last part matter? Because the ambulance crew can call ahead to the hospital. The neurology team will be ready when you arrive. Studies show that calling 911 instead of driving yourself can save 20 to 40 minutes of critical treatment time. And remember what we said earlier, 1.9 million brain cells per minute. Those 20 minutes, not nothing. One more thing for that phone call. Before you do anything else, when you pick up your phone, note the time, write it down on a piece of paper, on your hand, in a text to yourself. The exact time symptoms started is one of the most important pieces of information a doctor will ask for. It can determine whether that clot-dissolving medication is even an option. Now, FAST catches the majority of strokes, but there are a few other warning signs that don't fit neatly into those 4 letters, and they're important, especially for a type of stroke called a posterior or back of the brain stroke. Think about whether any of this sounds familiar. Maybe it happened to you or someone you know, and you just wrote it off as something else. Sudden, severe headache, not your regular headache, the kind that feels like it came out of nowhere, hits you so hard you'd describe it as the worst headache of your life. Doctors sometimes call this a thunderclap headache. This can mean a blood vessel in the brain has ruptured. This is a 911 situation immediately. Sudden loss of vision in one eye, or sudden double vision. This isn't the blurry vision you get from being tired. This is abrupt, with no warning, especially in one eye. Your brain controls what your eyes do. When something goes wrong, vision is often the first thing affected. Sudden, severe dizziness with loss of balance. Not just, I stood up too fast. More like the room is spinning violently, and you can't walk a straight line at all. This points to the part of the brain that controls balance, the cerebellum. Sudden confusion. The person doesn't know where they are, can't follow a simple conversation, seems disconnected from what's happening around them. If this comes on suddenly, not gradually, it may not be exhaustion or low blood sugar. It may be the brain going dark. Numbness on one side of the body, one arm, one leg, or an entire side feeling numb or tingly, especially if it came out of nowhere. Any of these signs alone or combined with the FAST signs is a reason to call 911 immediately. Okay, I really need you to pay attention here because this is the one that costs people everything. And the crazy part, it's completely, totally preventable. Maybe you've had a moment where you were reaching for your coffee cup, and for just a second, your hand didn't respond the way it should have, and then it passed. You were fine. You thought, that was weird, and went on with your morning. Or maybe you were trying to say something, and the words came out wrong, jumbled, and then 2 minutes later, you were speaking normally again, and you thought, must be tired. Or maybe you had a dizzy spell, your vision went a little blurry, and then it cleared up. You figured it was just because you hadn't eaten enough. Sound familiar? Maybe not to you specifically, but maybe to someone you know. Here's what the medical world calls those moments, a TIA, a transient ischemic attack, sometimes called a mini stroke. And that word transient, that's the problem. It means temporary. It went away. And when something goes away, we tell ourselves it wasn't real, it wasn't serious. The research says otherwise. According to a scientific statement from the American Heart Association, the 90-day risk of having a full stroke after a TIA can be as high as 17.8%. Nearly half of those strokes happen within just 2 days of the TIA event. 2 days. And a separate study from Oxford University found that the stroke risk within the first week of a TIA is somewhere between 8 and 12%. A TIA is not your body being dramatic. A TIA is your brain sending a red alert. It's saying, the plumbing almost failed, it barely held. Next time, it might not hold at all, and next time could be tomorrow. So here's the key. If you, or someone near you, has any of the FAST symptoms, even for 5 minutes, even if they completely go away, you still go to the emergency room that same day, not next Tuesday, not after the weekend, that day, because the doctors can find why it happened and start treatment that can actually prevent a full stroke from happening at all. This is one of the most powerful things you can do for your brain. Going in when symptoms seem like probably nothing, it has saved more lives than most people realize. All right, let's say you've made that 911 call. The dispatcher tells you the ambulance is on its way. What do you do in those minutes while you wait? First, stay calm. I know. Easy to say, hard to do, but your calm is contagious. The person having the stroke is often frightened and confused. A steady, calm voice helps them stay grounded. Next, help them lie down. Use a pillow or even a folded jacket to keep their head and shoulders slightly raised, about a 15 to 30 degree angle. Completely flat, not ideal. Sitting all the way up, not ideal either. Think somewhere gently in between. Loosen anything tight around their neck, chest, or waist. A collar button, a belt, a scarf. You want their breathing to be as easy as possible. If they vomit, and this can happen, carefully turn them onto their side. This is called the recovery position, and it helps prevent choking. Keep talking to them. Something gentle, calm, reassuring. Help is coming. You're going to be okay. I'm right here. Do not give them anything to eat or drink. Stroke can affect swallowing, even if the person seems fine and asks for water. There's a real risk of choking. Leave food and drinks for after the medical team has evaluated them. Do not give them any medications, not even aspirin. This is important. There are 2 types of strokes, one caused by a clot and one caused by bleeding in the brain. Aspirin could make a bleeding stroke significantly worse. The paramedics will decide what the person needs once they arrive, and do not put them in your car to drive to the hospital yourself. I know it feels faster. It isn't. The ambulance crew can begin assessment and treatment on the way. They can radio ahead to the hospital. When the patient arrives by ambulance, a neurology team is often already ready. That coordination saves minutes, and minutes, as you now know, are brain cells. Now we get to the part that I personally find the most exciting and the most hopeful, because after everything we've covered, I don't want you walking away feeling helpless. That's not the point. The American Stroke Association published a major guideline update in October 2024. It stated that up to 80% of first strokes may be preventable. And this isn't from a small study. This is from a national clinical guideline published in the journal Stroke based on the best available evidence. 8 out of 10 strokes, preventable. So let's talk about what actually drives that risk and what you can do about it. Blood pressure. This is the biggest one. Hypertension is a contributing factor in up to 90% of all strokes, according to research published in the StatPearls medical database. Nearly half of American adults have high blood pressure, and a significant number don't even know it. High blood pressure doesn't hurt. It doesn't announce itself. It silently weakens and damages the walls of the blood vessels in your brain over years and decades until one of them gives. Normal blood pressure is under 120/80. If yours is consistently above 130/80, that's a conversation to have with your doctor this week, not next month. Think about that for a moment. Have you had your blood pressure checked recently? Maybe you're checking it at a pharmacy kiosk occasionally, and you've noticed the numbers creeping up a little. Maybe your doctor mentioned it at your last visit, and you told yourself you'd watch it. That kind of mild worry and then putting it aside. That's extremely common and understandable. But that small climb in the numbers, that's your body signaling something you deserve to pay attention to. Smoking. Smoking is associated with somewhere between 2 and 4 times the risk of ischemic stroke, according to research published in Circulation Research. Tobacco use is linked to roughly 2/5 of all stroke deaths in people under 65. The World Health Organization lists it as one of the top 10 modifiable stroke risk factors globally. The good news? The risk begins to drop as soon as you quit. Blood sugar and diabetes. Diabetes roughly doubles stroke risk. High blood sugar damages blood vessel walls over time. If you've been told you're pre-diabetic or borderline, that's not a pass, that's a warning. Dietary changes, physical activity, and sometimes medication can genuinely reduce that risk before it becomes a full diagnosis. High cholesterol. Cholesterol buildup in the arteries is like slow-growing debris in a pipe. Over time, it narrows the channel, reduces flow, and increases the chance a clot gets stuck. Your doctor can check this with a simple blood test. Physical inactivity. Research published in Circulation Research found that highly active people have roughly 25 to 30% lower stroke risk than sedentary people. You don't have to run marathons. Walking 30 minutes a day most days has a meaningful impact. That's it. Obesity. Excess body weight worsens blood pressure, blood sugar, and cholesterol all at once. Even modest weight loss, 5 to 10% of body weight, can produce measurable reductions in multiple stroke risk factors. None of this is revolutionary, but it's real, and it works. The evidence is there. Now, here's something I want you to hear, and I mean really hear it. You might be 65, you might be 75, you might have some of these risk factors already. You might have had them for years, and you might be thinking, it's too late for me. It's not too late. The research on stroke prevention repeatedly shows that lifestyle changes and treatment at any age produce real reductions in risk, not perfect protection. Nothing in medicine is, but meaningful, measurable, real reductions. Your brain has more flexibility and resilience than most people give it credit for. And every single change you make in the right direction counts. You've been with me for almost 14 minutes now, and I know the most common thing that happens after a video like this. People feel motivated. They close the tab. And 3 days later, they've mostly forgotten the specifics. That's just human nature. It's not your fault. It's how the brain works. So here's what I want to do. I'm going to give you 5 specific actions. Not a long list, just 5. Pick the ones that feel right for your situation. 1. Teach the FAST test to someone you love this week. Ideally, practice it together. Smile for me, raise your arms, say this sentence. That's literally 2 minutes. Do it at dinner. Make it a little awkward, and then laugh about it. Awkward and remembered beats perfect and forgotten every time. 2. Put the number for your local emergency services, 911 in the US, somewhere you can find it instantly, even if you're scared and your hands are shaking. Know your address by heart. When you're calm, it feels silly. When you're panicked, that information sometimes disappears. 3. If you have a smartphone, fill in the medical ID or emergency contact section. On most phones, paramedics can access this without unlocking the phone. Your medications, allergies, emergency contacts, fill it in. 4. If you have risk factors, high blood pressure, diabetes, high cholesterol, excess weight, or you smoke, make an appointment with your doctor this month, not to scare yourself, to know your numbers. You can't manage what you don't measure. 5. If you ever experience symptoms, even mild ones, even ones that go away in a few minutes, go to the emergency room that same day. Don't wait to see if it comes back. The window for prevention is open after a TIA. Don't let it close. When I started this video, I told you that somebody's brain was shutting down right now. Here's the other side of that statistic. According to CDC data, patients who arrive at the emergency room within 3 hours of their first stroke symptoms often have significantly less disability 3 months later than those who get delayed care. The treatment window matters, the ambulance call matters, the 4 letters matter. Those 4 letters, FAST,